Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast. My name is Terry Fletcher. This week, we are going to enjoy a segment called What the Heck is Going On in Healthcare? So it's almost like WTH. I actually, as most of you know, do a podcast called WTF, What the Football, for Steel City Underground, talking about Pittsburgh Steelers. But I feel like every week I need to do a WTH, What the Healthcare, because there are some headlines that have been popping up that actually surprise me. And I'm thinking, wow, that's really happening. Some are good, some are interesting, some are not so good, and some are just like, I can't believe that's actually something that could be passed or happening. And when we talked about it with Medicare, trying to go to a single payment system for E&M in the office, that was frightening. And we're not even sure where they are with that yet. They're hoping to give us some transparency soon. But when we were talking about this week, it's interesting what's going on. And I want to bring that to you this week in case you missed it. So that's what we're going to be talking about this week. But first, the Codecast Podcast is brought to you by Women in Healthcare UK. Women in Healthcare is a community for healthcare professionals aiming to provide a platform for women within the healthcare sector, networking, and healthcare. United Kingdom, England, womeninhealthcare.co.uk. So I'm going to jump right in this week. And one of the things that came up and popped up on my email was that United Healthcare is now going to create their own electronic medical record, so the acronym EMR, for their employees because they are a self-insured healthcare system within their payer system. So if you work for United Healthcare, basically, you also go to who they tell you are your providers are, kind of like a Kaiser situation. But the thing is that now they're talking about requiring contracting providers to have to use their EMR if they want to contract with this payer. And remember, you know what? The healthcare providers are not entitled to all access of your medical records. And when I say provider, I actually mean the insurance payer. So that is something to watch. Make sure you're watching that story. Another story that came out of Naples, Florida, is that, and this was interesting because this was from the Florida Daily News, and I thought it would draw more comments than actually what it did. But there's a pilot project at NCH Healthcare Systems, and it is a hospital down there. And a lot of physicians are not happy because what's happening is that the NCH hospital wants to only employ hospital-based doctors, known as hospitalists, for handling all admissions and patient care. But for both hospitals, they have a couple of hospitals down there. And what's interesting about this is that the reason is that biggest thing right now is patient outcome satisfaction surveys. I've mentioned this before. But when you have a physician that is not employed by the hospital, but they have privileges at that hospital, and let's say they're admitting their patients, and then the patient is there, they're admitted, let's say, to the medical floor or to the surgical floor, whatever, and then they want to see their physician, well, then the staff at the hospital tries to contact that physician somewhere in the hospital or at their office, and sometimes it's a trek to try to find them. And then let's say they find them in their office, and they'll say, okay, well, we have an office today. The doctor will be there at some point during the day. Just let the patient know. They'll see them later. And that's kind of an open-ended, okay, when are we seeing them? Well, what the hospital was saying is that when patients are now basically leaving the hospital and then they get these satisfaction surveys, or they're called by their insurance company saying, how did you like your stay, or what happened? What then happened is that they're kind of a guilt by association. If they can't see their doctor, or there's not access to their physician, or they were maybe even asleep when their doctor came and rounded on them, they were saying that they didn't see them, and the satisfaction surveys were terrible, and basically saying that the hospital was not good. And so then they were having a hard time keeping their insurance contracts. But since this practice has begun in June of involving just hospital-based physicians or hospitalists spending their entire workday either on one hospital floor or seeing patients throughout the entire campus, they had found that there were fewer readmissions within 30 days of discharge. They found that the patients and the families liked the improved access to a physician throughout the day. And again, patient satisfaction scores went up. So this is usually something you would see in a critical care unit or ICU. But now I'm finding that some hospitals are basically saying, we're going to start doing this. And so primary care doctors are not going to be able to admit at some point to all hospitals. And concierge medicine, this is really going to hurt them, because they would lose their admitting privileges. And for those of you who don't know what concierge medicine is, I'm actually going to do a podcast on it. But it's basically a doctor who says, give me $5,000-$10,000 a year and you have access to me whenever you want, versus the patient who has insurance where I'm only getting the insurance standard, usual and customary reimbursement, and you're going to the hospital and I'll be there when I want. So concierge medicine isn't going to be as all access as they tell their patient for what they're charging. And so this is just an interesting concept, because I can see both sides. I mean, I believe that the quality of care will probably go up. The only problem is that you're going to have some patients that really want to be taken care of by the physician that they know, not just any physician who's available. And also, you want to be able to have the physicians who are the quality physicians that are not employed by the hospital still be able to admit. But this just becomes such a political arena, and there's going to be some really interesting outcomes when it comes to can they keep this up? Community physicians do bring value to the table, but there is more to quality than just length of stay, 30 days readmissions and things like that. But for example, one group out there, Millennium Physician Group I was talking to, they basically said, we want to be able to take care of our patients. But again, we do understand that this delivery of healthcare involves important metrics like quality, best outcomes, patient satisfactory scores, and then also collaborative efforts, making sure that beneficiaries have physician access. And so just know that this is something that's coming. They're starting it in Florida. I have also seen it in New Jersey, but it could be the new standard, not just in the unit, where you as a physician, if you're a specialist, you still might have access, but if you're a primary care physician, you may not have access to admit your patient. It may be all for the hospitalist. And if that does happen, what that means, you as a physician, is that you're going to have to keep longer hours to see your patients, because if they need to be seen after hours, they're usually sent to the hospital, but you're going to have to be able to see them in an outpatient setting. And then only if they really have a problem would you want to say, okay, go ahead and go to the hospital and then I'll see you on Monday, since I don't have privileges, over the weekend, and you have to wait till they were out and just correspond with the physician who it's under their admission and their treatment, so and under their care. So anyway, just keep a lookout for that, because Florida, we call them cowboys. They just love down in Florida to do weird stuff, and they have so many retirees and so many patients that, affluent patients as well, that can do a lot of things. Again, bringing back that concierge medicine. So I just think that headline is going to be far-reaching as far as physicians being taken out of the admission process, and only the physicians who are employed by the hospital will be able to admit at some point. So keep an eye on that story. It's definitely out there, and I could see it being a hot button coming up in 2019. So I wanted to pause for my coding question this week, and this comes from a Nebraska client. It says, Terry, the cardiologist performed a heart cath via the patient's subclavian and groin to retrieve a broken piece of a portacath that had floated into the atrium and lodged into the ventricle. In the operative report, the cardiologist stated that he had to go through both locations simultaneously to guide the piece out of the ventricle and out of the patient's body. What's my CPT code? Because I think I should get paid, or at least be able to attempt to bill for both access points. Well, sometimes less is more, and this is one of those times. So the code 37197 says transcatheter retrieval percutaneous of intravascular foreign body. So, and they also give an example, e.g. fractured venous or arterial catheter. It includes radiological supervision and interpretation, so imaging to help guide it out. And it says, and image guidance, ultrasound or fluoro, when performed. And so there's no mention of dual access or how many accesses. It just says that this is how you take it out. So any method. So I definitely would use that code, would not charge for any access point because that would be inclusive of the code. Now remember, this is for transcatheter retrieval. If you were doing a vena cava filter retrieval, then you would instead report 37193 for that. But go back to your 37197 when it's that transcatheter retrieval of that fractured venous or arterial catheter. Okay, so one of the biggest headlines, I think, that came out this week, and this was kind of interesting for me because I was like, okay, I'm a big investor. I love to, I don't want to say play the stock market, but I like to guess on things, and so far I've been pretty good at it as far as what is up and coming, what is something that really is going to make money, and where the insight's going to be. And everybody knows that Amazon is huge. I mean, let's face it, Amazon is, what are they? The biggest digital retailer on the planet. Whenever I'm thinking, oh, I need something, do I go right to Barnes & Noble? Do I go to Crate and Barrel? Do I go to JCPenney? I mean, do I go to the store? No, I actually go to Amazon first. And then I see where they're actually pulling it from, and then see if it's actually a better price at the actual store it's coming from, or even if there's more selection. But Amazon, they went from online bookstore to online everything store, and really a leader in e-commerce. And so when you look at that, and you look at how they've expanded their original business model, their core. I like to say that because I have about 12 branches of my business, and I always stick to my core and then branch out from there. And they did the same. And it's just interesting and really impressive, actually, how they have expanded to one of the giants out there. I mean, they continue to disrupt the industry after industry and everything that they're doing. And so now they're breaking into healthcare. And that's why I wanted to bring it to your attention, because Amazon has created an alliance with JP Morgan Chase and Berkshire Hathaway. And it's more than just selling healthcare products. And so what I had found on this is that they are really going to make waves, and they've done it a lot in the healthcare industry over the last 12 to 24 months. So they've become very ambitious, and it's further than just simply selling healthcare products. They have an initiative. Now, it's still in its infancy, and it's limited to employees and the three partners, but of the three partners, I should say. But the statement sparked kind of a lot of speculation, and sent the stocks of some insurers and major healthcare companies into a little bit of a tailspin. I also just recently decided, when I saw this, I was like, I'm purchasing Amazon, because follow me here. And this is not to encourage you to do that. I would never do that. That's probably not appropriate. But it's just to give you some insight as to where the healthcare industry is changing on one of, again, the biggest disruptors in business that's out there. But anyone who continues to think of Amazon as just a digital retailer really needs to think again. I mean, they have put business to business, e-commerce platform, in-home services, over the course of their existence, they just continue to expand. And, Amazon is serious about healthcare. Okay, first, as one of the largest private employers in the United States, Amazon would reap huge benefits from lowering the high cost of healthcare in this country. And second, the numerous inefficiencies of the healthcare system that I keep showing you, I would think Jeff Bezos, who is the CEO, he always says something that I really like the comment. He says, your margin is my opportunity. And when you think healthcare is just kind of a big, complex problem, he would sink his teeth into it. I mean, he is just an innovator. And when I look at what he does, now, first of all, I love him because he's a Star Trek fan. And some of you are like, okay, Terry, that's a little bit left field. But, I know some of you are Star Wars fans out there. Yeah, not me. I know that the lightsaber thing and all that is pretty exciting. But I think he's one of those, he aspires to boldly go where no one has gone before. And he's invested billions in space exploration with his company, Blue Origin. It shows he's willing to put his money where his mouth is. And while healthcare poses a challenge, I think he believes that Amazon has a role to play in making things better. When you're talking about Amazon, and think about this for a second, They have many of the core competencies that are needed to compete in healthcare, from data and analytics to technology and also to innovation. And also, they've also started testing the waters, both not just in the United States, but in markets outside the United States. So, for example, in Japan, they've decided that they're going to start offering Prime, now drug deliveries directly to consumers who actually have approval to be able to get deliveries from a pharmacist. Stateside, the company has begun recruiting for multiple healthcare related positions. And some news outlets have even reported that they are looking into medical records and virtual doctor visits. They see what's going on in the industry. The initiative, which is joint again with JP Morgan Chase and Berkshire Hathaway, they'll give a broad leeway into experimentation, and it can help them be more aggressive about learning. But as they turn their focus to healthcare, this is what it could look like. And these are things that I was collaborating with some colleagues on this, and we were just talking about it over a round table. And it was just kind of nice to just sit there and say, where do you think they could actually go with this? So I think there's 5 potential points of where they're going to go with this. And this is what I want you to keep in mind, and just, always keep your mind open to what's going on in the industry. First is durable medical equipment and supplies. So this one's a no-brainer because Amazon is already there. It currently sells a broad array of generic and general medical supplies, durable medical equipment, which is DME, to consumers. So basically, they're going to expand, I would think, into wholesale distribution, which I would think is the next logical step, because what that means is that they're going to sell directly to providers in a variety of medical settings. And in those states, licensed professionals can enroll for something called Amazon Business Professional Healthcare Program to order restricted access products. And if Amazon starts selling to hospitals, this could significantly disrupt the established group purchasing organization contracting model, because some of the original equipment for this and manufacturers are already starting to sell older and more established equipment directly to the hospitals without the sales reps. So on the business to consumer front, Amazon could also disrupt the self-pay DME market by providing price transparency and simplified online platforms so patients can buy consumable or DME products for their home use. So this is where, talk about a wake-up call for supply companies and retailers who need to focus on greater customer engagement instead of just the purchasing process. The next thing I think they're going to focus on would be mail order and retail pharmacy. So Amazon appears to also have mail order pharmacy players in its sites. Been talking to a couple of players, and it's a little bit insight at Amazon, and it has secured approval as a wholesale distributor from 12 states for pharmaceutical boards. So while the company faces some little bit of hurdles in complying with drug storage and distribution regulations, they're not insurmountable challenges, not for Amazon. And they also just, remember, had a recent acquisition of Whole Foods. So these stores could be used to house brick and mortar pharmacies that would be powered by Amazon's mail order fulfillment capabilities. See how they stick to their core and then they just keep branching out? And they have other significant capabilities that strengthen their position. So their digital platform. So some of the analytics that we were kind of looking at could be leveraged to create digital health tools that track and influence patient behavior. And this could give them some insight into certain healthcare deliveries should Amazon choose to enter the mail order pharmacy space, which would not surprise me. So right now, Amazon Prime now is striving for 2-hour delivery times. So that would put pressure on existing mail order pharmacies to improve their delivery times for essential prescriptions just to be competitive. I would think pharmacy benefit manager would be another thing that they're going to leverage to try and get in on that, because the pharmacy benefit manager market is fairly consolidated. So they're going to enter a space either by partnering with a large company there, such as, some, I would think like Express Scripts, or maybe buying maybe a smaller company like Prime Therapeutics. So this would give them access to claims adjudication systems, networking of pharmacies, and then their relationship with millions of Amazon Prime customers. I'm one of them. I'm sure you are too. This would give them leverage to improve patient compliance and healthcare behaviors as well. It's just their access is so far reaching. And then I'm going to bring it up because it seems like I'm always talking about telemedicine, or what we call in-home healthcare. And the 3 points of entry discussed that I just mentioned really help leverage Amazon's capability in logistics and distribution, as well as to negotiate really low prices. I hate to say they're kind of like the Walmart of, digital age and delivery, but they've shown that they're more than just a distributor of boxes. They know machine learning. The company has launched, successful Echo, when we get in there, a smart speaker, and connects to the voice controlled intelligent personal assistant, Alexa. So that's the market leader. And so with all of those sold, you just know that healthcare is going to be more of their activated services. And Bezos was even at a lecture that I attended recently, and he's just so interesting to listen to. But he's talked publicly about the role for Alexa in the future of healthcare delivery. I actually had a podcast on the virtual assistant, and they're not always accurate. Alexa is one of the more accurate, but he's going to have to really be careful if they're going to offer telemedicine through current Echo devices, because they would have to show that it's accurate, it's HIPAA compliant, that it has the smart speakers, a screen, but it has to show an opportunity for video telemedicine, with helping with conversion as consumers become more familiar with the concept of telehealth and in-home healthcare. But I could see this being the next step for them. I mean, they really like to facilitate where people don't have to leave their home. And so they want to do something where they could apply downward pressure on the price to treat common illnesses at a doctor's office and walk-in clinics, to force those establishments to diversify by offering telemedicine visits, late night hours, weekend hours, or something in their home. So it's going to be interesting just to see how they really look at that. And the last thing, I think it's going to be artificial intelligence powered by diagnostics and continuous care. There's every sign that the long-term vision for Amazon is not only going to disrupt healthcare position and provisions as we know it, but I would think that they are going to be one of the biggest in-home artificial intelligence delivery of diagnostics. They've already made, those tremendous strides, as we talked about, in what Alexa can do, and the skills for, voice-driven self-care instructions for a variety of situations. But luckily, the Mayo Clinic has cleaned that up a little bit, because right now it's just limited to first aid information. But everybody listens to what these virtual assistants say, and I could see this technology it can unleash first-line diagnoses, providing reminders to take medications, auto-replenishing prescriptions. Can you believe that? Where you didn't have to call in to get your prescription. And some consumers may resist the idea of this, that receiving healthcare advice without a medical professional. But you're looking at regulatory and safety hurdles as well. But I could really see the AMA and Amazon just jumping on this. And so for many people, including businesses executives, they really need to view Amazon as being a leader here. Do not dismiss them. They are going to take their core business as a technology company, and they're going to apply it to healthcare. And if Jeff Bezos feels that that is one of those problems that he can fix, he loves to fix it, loves to tackle it, he will go crazy doing that. And I think Amazon has the potential to not only make meaningful strides towards realizing his vision, but I think it could be a quick leader in what's going to happen in healthcare. So those are some of the things that have just come up in the industry that I didn't know if you ever have a chance to really take a look or what's going on there, but it's just crazy to me, some of the headlines this last week that have popped up. And then the last thing I wanted to address, and I know I already did a coding question, but for the pediatric physicians that are listening to the phone call and pediatric practices, I wanted to bring something up that came up in my situations this week where I was all over the place. I was, and I had an hour drive away for an office that I did some training. I had to go up to Fresno, which was a 5-hour one-way drive for me, 24-hour turnaround. So I came back, which was really nice to go up there. As far as the staff was awesome, did some training. And then I did a couple of online trainings. So this was a very big training week for me. And then next week I'm down in San Diego for a 4-day training with a big healthcare system. But I noticed that, and this is funny, so I got some of my material from one of these places, and I got an email saying, Terry, I know this is mandatory within our practice, and that's why we have you come in. But I have a pediatric physician who's saying that they're refusing to go to the meeting because we base everything on what Medicare says, AMA says, and he's pretty specific that he says, well, that's not pediatric. Okay, you need to regroup. This is pediatrics does not have its own set of guidelines when it comes to evaluation and management services. E&M services, the visit codes, the consults, all of that, Medicare and American Medical Association, there's one template. It may be expanded one way or another per payer, but it doesn't matter if you're pediatric versus adult medicine. You still have to follow the guidelines just like everybody else. And I think my head spins around a little bit when I see a practice or a healthcare organization putting something out that says compliance is mandatory, that you have to attend education meetings, and then you get a doctor saying, well, I respectfully decline. That should not be an option. Mandatory does not mean optional. It means mandatory. You go, or as we were talking about the last 2 weeks in the compliance manual, there are consequences to you not fulfilling what the contract says you have to do. So just a heads up, if you're a pediatric physician out there, unfortunately for you, you do have to follow what AMA and Medicare says. So just keep that in mind. There's no special treatment for you as a pediatric physician. And I know it's a little bit sad, but it is true. So I just want to make sure you're aware of that accurate information. And then I wanted to bring up another personal tidbit on myself. Everybody asked me to do that for each week, so I'm going to do that for a little bit. So one of the things, if you don't know me, I love wine. I don't like white wine. White wine is Kool-Aid to me, but I do like reds. Cab's my favorite. And if you ever get a chance to go to Napa, I'm going to recommend one of the wineries up there, and it's called 1111. And I like their calls tag. It says 1111, where you know how you can make a wish when it's 11 o'clock and 11 minutes. That's kind of, you make your wish and it comes true. But one of their call signs, it says, make your moment every day. And I really pride myself on not just the positive, but just keeping things just on the up and up, just really positive, looking forward, moving forward, and forward motion, paying it forward, and doing anything you do to uplift. And so hopefully you'll get a chance out there, but try their wines. It's amazing. It is so good. And I need to try my wines. I'm sitting here looking at my 64 bottle of wines thinking, okay, I just updated my inventory and I haven't had wine in a while. So maybe that's what I'll be doing tonight, is drinking wine. So in closing, I just want to let you know my ebook publications for coding are on my website at terryfletcher.net. They're $59 each, and it is a workbook. So you'll get it as a PDF file so you can print it off for anyone in your office. But we have cardiology, gastroenterology, orthopedic surgery, and other specialties. And it's about a 50 to 60, I think one is 80 pages, but it's just a workbook on the generalities of your coding specialty. So if you're looking for a good price for a workbook, feel free to take a look at those. And they're up there for 2019. So we hope to have you as a client and appreciate our educational materials. Also just updated our schedule for webinars, seminars, live conferences through the end of 2018. So again, take a look at my website, and hopefully you'll find something that will be good for you to continue your education in coding and billing and compliance and management and all of that. So again, hope everybody has a great rest of your week. Make it a great day, and thanks for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.